Nasal septum. The nasal septum is made up of the osseous cartilaginous part. The bony part includes the perpendicular bone and the vomer. The cartilage includes the septal cartilage and the septal process of the inferior nasal cartilage. The lower margin of the septum is called as columella. The nasal septum is deflected. The nasal septum has four borders: anterior, posterior, superior, and the inferior border. It has two surfaces, that is the right and the left surface. Blood supply of the nasal septum is done by the anterior ethmoidal branch and the posterior ethmoidal branch of the ophthalmic artery, sphenopalatine branch and the greater palatine branch of the maxillary artery, and the superior labial branch of the facial artery. The first, the third, fourth and fifth, that is the anterior ethmoidal branch, sphenopalatine branch, greater palatine branch and the superior labial branch arteries anastomoses in the anterior inferior part to form the Kisselbeck's plexus. This area is also known as the Little's area. It is the most common site for bleeding of the nose. Bleeding of the nose is called as epistaxis. Venous drainage of the nasal septum. Anteriorly is the facial vein, posteriorly is the sphenopalatine vein. Lymphatic drainage of the nasal septum. Anteriorly we have the submandibular nodes, posteriorly the retropharyngeal and the deep cervical nodes. Nerve supply of the nasal septum is done by the olfactory nerve, external nasal nerve, nasociliary nerve and the nasopalatine nerve. Clinical anatomy of the nasal septum. The Little's area is the common site for nose bleeding, or also called as epistaxis. The sphenopalatine artery is responsible for epistaxis. Common cold is caused due to pathological deviation of nasal septum. It requires surgical correction.